Hi there, this is Henry Sifu Slim Kreuter, and I am excited today to be online with a very special person who's got a new book out. And so that's something that I am very excited about. And I hope you, the audience, the viewing audience, will learn a great deal and enjoy the conversation. So if you are a hardworking person and you put together a book and now you're bringing it out to help people and educate them and inspire them to be well and to pursue wellness, you would want to find a doctor who's a very special woman. And I'm speaking with Dr. Heather Shenkman, coming from Tarzana, California, and I'm in Honolulu. How you doing, Dr. Heather?
Doing.
So your book is The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. And that's been out since January of 2018. So
Yes.
you were inspired to write this book. So maybe you can tell us a little bit about your journey in life and how you came to do what you do, and then what propelled you to put yourself out there with wonderful information to help others.
A little bit about my background. I am an athlete. I'm a triathlete. I've competed in 2 Ironman distance triathlons and cycling races and triathlons and marathons and races of all distances. And certainly I bring that passion for athletics to what I do as a cardiologist and encouraging my patients to get to be active. But I also am very passionate about lifestyle and food choice and eating a whole food plant-based diet, which I consider to be the healthiest diet for the heart. So over the course of the years, I've really wanted to put together a book detailing what I'd like to convey to my patients, or even people who aren't necessarily my patients, about what you can do to keep your heart healthy. And that's where I came up with this book, The Vegan Heart Doctor's Guide to Losing Weight, Reversing Heart Disease, and Reclaiming Your Life. It took me about 7 years to put this together. It was a long project.
Yeah, and the writing of books is interesting. We have these ideas in our head, and when we start putting them down, and then we check some sources and check some studies, and then we get new ideas, and then we may pass this along to an editor or 2 or 5, and then they suggest things, and all of a sudden 5 or 8 years goes by, and we've come up with this thing that's kind of like our version of Michelangelo's Sistine Chapel, something that took us quite a bit of time, and then this is
Right.
the best we could do at the time. Is that the journey that you took, Dr. Heather?
To some extent, yeah. There were a couple of other books out by vegan cardiologists, and they're good books. Dr. Joel Kahn had a book out. Dr. Baxter Montgomery also had a book out. Both of them are plant-based cardiologists, and I felt like I could give my own spin to things. So I looked at what they put together, which was really good stuff, and I kind of took my own angle in terms of what I wanted to convey, and I put that to paper.
That's wonderful. And so, as a cardiologist, I mean, that's one of the uh, physician categories that we think of that's, of the utmost important. Not that any other physician practices aren't important, but cardiologist is like a do or die thing. I mean, we want to we want to avoid the cardiologist in general. We want to maybe go in for checkups to our normal physician, and then we come to see you typically when there's a problem. Is that an accurate statement in 2018?
In general, I would say yes. You want to be healthy enough such that you don't need to be following up with a cardiologist regularly. The majority of the conditions that I treat are diseases of lifestyle, anything from blood pressure to coronary artery disease to diabetes to even some of the valvular abnormalities are very much a product of our lifestyle.
If you had to guess, and maybe that's not the proper word, but if you had to estimate perhaps what percentage of people who come to you with a problem, whether it's acute or chronic, and there is a lifestyle change that could remediate that problem, is there a percentage that rings a bell?
I would say the vast majority of conditions that I treat, I'd say 80 to 90%.
That's really good news to the people out there who, they may think right now that they have a certain food way that they eat and a way that they live, either high stress or high sedentism or both, and maybe a poor diet. But you're going to give them some news, and you're going to give them a plan. And your book is probably a wonderful way to kick off things for some of that group, where they can make these lifestyle changes and see results rather, in a relatively short time, see some positive directional consequences from those lifestyle changes. Is that correct?
Absolutely. And I think my book is a great place to start if you happen to be a patient and you have heart disease, or you're concerned that you're going to get heart disease, or you're at risk of heart disease. It's a good starting point to look into, what, first of all, learning what heart disease is. I talk a lot about that, what high blood pressure is, what diabetes is, what cholesterol is, a little bit about the medications to treat it. I talk a little bit about exercise, about then getting the motivation to start an exercise program and how to stick with it. And then I talk about diet, and I talk about why a plant-based diet really is the ideal diet for heart health, and how to go about following a plant-based diet and sticking to it. And then I try to wrap things up by bringing it all together about how you can really live a good, wholehearted life.
As you're speaking and you're giving me these wonderful nuggets of wellness wisdom, I'm thinking that a busy cardiologist who may have a shorter appointment than a psychologist, maybe a psychologist is with a patient for an hour, and you're with them for a shorter time, the messages that you give in 2 minutes about some lifestyle changes, and then come back and see me in 2 weeks or 2 months or whatever your time frame is. Those little nuggets from a busy cardiologist who's got to go into surgery right after that appointment, they may have quite a bit of an impact on that person, because you've shared just a brief thing rather than gone through a lengthy appointment. Does that sound like it might provide those positive effects that I'm suggesting?
Well, I'd like to think so. I mean, if I really had all the time in the world, I think there are patients I could probably sit down for an hour with them and just go through what they're eating and their exercise habits and help them to make a road plan. I don't necessarily have all that time, but at the very least, I can kind of get them on the starting point. I can get them referred to people who can help them, like a good nutritionist, and then bring them back in a month or 2 months and see how they're doing, and continue to guide them towards making good choices.
Yeah, you give them resources to step through and to walk through, and they can take that where they'd like to, and then you get to see them again to see what they've done, and then you can put that in your memory bank and maybe help the next person using some of that information and some of the results. So I was fortunate to have some time also, and I put together my first book called Sedentary Nation, and I say the answers are not found in the new millennium; they're in 1910. So basically, what I'm saying is that our great grandparents back in 1910, they were moving all the time. So yes, there was stress, and yes, there were issues of diet. Yes, they worked, many of them 7 days a week, and many for long hours, and lived in, some of them maybe have lived in tenement apartment buildings in New York City and these types of things. So they had their challenges, but obesity was very rare in this era, and sleep problems was very rare in this area. And why, if I threw the sleep problems out there, why do you think, just judging from what you've heard from me and what you may have read on your own, why do you think the 1910 people may have had less sleep disorders, trouble going to sleep, than the people in the new millennium?
A few good reasons why folks back then were able to sleep better. First of all, they probably had less stress than we did, fewer thoughts coming at them. But also they were not as heavy. I think a lot of the issues that we see with sleep problems, such as obstructive sleep apnea, are conditions that are related to overweight and obesity, and these were people who were slim probably had less of those issues.
Yeah, we're back to stress, maybe causing overeating, and lifestyle causing overeating. We're in a more is more part of the human existence. There were times, like in ancient Egypt, where they had problems of sedentary behavior, affluenza. Some people have termed it, where these wealthy people had everyone doing all the work for them, and sat around eating and drinking, and lying around, and not doing a lot of movement. Maybe their only movement was walking to their version of a restroom. So now in the modern era, you mentioned stress and overweight as problems causing sleep disorders. And what I found equal to those, and maybe even more so, is that our ancestors were pooped out. They were exhausted many times. So if you're working on the farm, you're working in industry, you're working in a shop, let's say, in a big city. You're walking home. You're on your feet all day. If you're at a shop, perhaps. So you're at the end of the day. I'm not saying this is beneficial, but if you were a working person where you didn't get to choose your working hours, you just had to kind of get through it. These people were exhausted. And so if you're exhausted at the end of the day, you're tired to an extreme level. And if somebody's snoring next to you, or if the people are making noise in a bar 2 doors down, you can go to sleep, hopefully, because of this exhaustion. And the people in the modern era, what I found is that there's a lot of digital clicking at 11 o'clock at night, at 1 in the morning.
Yeah.
And if you're up that late, you may reach for the frozen foods, the microwave foods, or if you, some people I've met, they drive out at 11 o'clock at night and they go to 7-Eleven to get their fix. And maybe you could share some of your thoughts on these behavioral issues.
Well, I think we're definitely too connected, and I'm definitely guilty of this as well, because I'm on call most of the time, being that I have a solo cardiology practice. But it's very hard to just put the devices away and just live and be in the moment. And I think we all need to do more of that, myself definitely included.
Yeah, I would guess that if a woman, a busy cardiologist such as yourself, had a child or two or three, you would probably flip the switch to, you know, telling your employer that you needed someone else on call, because now you have a family, and a lot of people take care of their family more than they do, so they flip the switch to quieting down the digital when they have their family, because of all the responsibilities and wanting to give those kids their time and look out for them. Is that something that you think is an accurate statement?
I think that makes sense. Right now, where I'm at, I just started my own solo practice in January. So I'm very focused in making sure that my business succeeds. So at least for now, I've maintained myself as being on call the vast majority of the time. As things progress, as my practice grows and I feel a little bit more confident and secure at how everything is going, not that it's not going well, it's going fantastically so far. But then perhaps I'll kind of shift some of that on call. I'll do duty to others.
Yeah, you're in the beginning stages. I understand that. And there were times where, and I still do sometimes now, when I'm on a project, I may work a lot of hours, right? And then maybe accessible to people later on after dinner, that type of thing. But I'm fortunate at age 55 that my life is a little less busy in terms of being available to others than it was in my prior decade. So that's actually good for my heart. So if you're my cardiology, you might say, hey, Sifu, that's a really good thing that you're doing now for your aging heart.
If you need a cardiologist in the first place, which from what I know about you, you probably don't.
Well, I would like to, if I did have the extra time and budget right now, I would love to know what some of my EKGs and all the other realm of things that you might test aging athletes on to see how their heart is doing under stress tests, at rest, after less sleep, more sleep. I think that might be good to know for my own future plan of how I'm going to go from 55 to my dad, who just turned 90, to
Wow.
age 90, you know, and he's still active. Is there a plan that you've seen out there from your training and your colleagues to take people like me who seem to have things clicking along pretty well and want to have a little bit more of a roadmap for their next portion of life?
It's a great question, and I think a lot of it is, maintaining good habits. You write about it in one of your books. People who are, when they're younger and they're very active and competitive athletes, and then they get to middle age and they become entirely sedentary. I think there needs to be a focus on being consistent with remaining active and not becoming a couch potato and resting on your laurels of being a competitive athlete for so many years. I think that's important, as well as continuing to eat healthy and manage stress and have good relationships with friends and with family as we get older.
Yeah, that's in all of the books on longevity, the being around friends and family, those Okinawan women and men, but the women is the picture I have in my mind, like a woman who's 108 years of age, and she has her garden in her backyard. And some of the Blue Zones books talk about this and other books. And then she goes out and does her gardening. She goes and plays card games with friends she's hung out with for 90 years, you know, as a little kid in the neighborhood, and now as a senior, so, you know, a centenarian, hanging hanging out with these people. And then her great grandkids stop by for words of wisdom or to share a meal and to keep connected to her. And this is such an important thing. And do you know scientifically why that is?
Why it's important that we maintain good connections with others.
Yeah, and then being an older person, being being around family and friends, and what that does to us physiologically.
Well, I know that being connected keeps us in good spirits and keeps us happy and keeps us from being depressed. You know, on the contrary, flip side of that, you know, isolation breeds depression, and being depressed definitely is associated with worse health outcomes.
Got it. That makes all the sense. I have a question on my end. So I have a friend, and you know how you think you know something, and then someone shares some information on you that's new to you, and then you have to, again, change and flip the switch in your own brain to become more aware of this new wisdom, this new knowledge. So I thought that you could kind of maintain, you know, the physicality that you were doing at a younger age as an older person, and you just keep doing it. You know, you have different bodily changes, of course, but you can just keep doing it and maintaining some of those regimens that you're doing at a younger age. So I thought that was the case, and then I'll share this with you. This is a story from a friend of mine. So he said that his dad was an athlete in high school, and then he got into the military. So he was trained in more performance-oriented physical activity, boot camp, and these types of things. And he got into some recreational volleyball, tennis, running, but he was kind of pushing it, you know, pushing things all the way up into his 70s. And then he went to the cardiologist because he was having some issues. And the doctor told him, he said, look, he said, you're not a young person anymore. The heart valves function differently for most of us when we reach a certain age. So you have to change your physical regimen according to the changes in your valves, in your veins, and your system. And he says, but right now I've got some new news for you. You need a pacemaker, and you need heart medication. He said, you're running the wrong way. You're running excessively, and you're running with too much pressure on your cardiovascular system. So does this sound like a common story from people who deal with these older patients, as you may be dealing with? And does this sound logical to you and from your training?
I think the anecdote that you share, I don't think that this is a typical person. If this is somebody who needed a pacemaker, this is somebody who clearly had something abnormal going on with their heart, who had degeneration of the electrical system that leads to good contraction of the atrium, the ventricles, and them syncing together and providing adequate blood for being active. So somebody who certainly has degenerative disease of their electrical system, who needs a pacemaker, yeah, they're definitely not going to be able to function at the level that others are, because they're just not going to be able to get their heart rate up. But that said, I think that, you know, in terms of being active as you get older, I don't think you really need to do much to change what you do. I think, you know, you're not going to be able to run as fast as you did when you were 18 years old, but you still can be very active.
Got it. Okay, so you're saying that perhaps that this person's training regimen wasn't the cause, but the result of his heart physiology and the aging process that he endured caused things that he needed to, that those were the causes that made him have to adjust his training regimen, not the other way around.
I would say that sounds right. It doesn't sound like his training regimen led to his need for a pacemaker, but rather that something inherently was going on with his heart that led to his conduction system not being able to accommodate his exercise and daily living patterns, and thus led to him needing a pacemaker.
Got it. And you mentioned being a high school cheerleader and then moving into some other physical activities like running post high school. How did you make the transition from being like in a team sport with lots of coaching and lots of practices to doing more of your own thing, if that's an accurate way to assess what you transitioned to?
it was definitely a much longer process than that. I was a cheerleader in high school, and really the only reason I took up cheerleading is because we were required to do a sport, and I found that I enjoyed being a cheerleader. I liked, performing and the routines, and it helped me to. I'm not the most coordinated person, but I'll tell you, being a cheerleader and having to learn the routines and whatnot, I became more coordinated, which is a good thing.
Yeah.
But when I went to college, I really stopped exercising. I ate garbage. I was a lacto-ovo vegetarian at the time. I ate pizza. I ate ice cream. I gained like 25 pounds my first year at college. Um, and it wasn't until really my second year of college I came to a realization that, if I'm going to be a doctor, I need to be practicing what I preach. And so I cleaned up some of my eating habits. I started actually incorporating some vegetables, and I started exercising. I started rollerblading. I started lifting weights, doing aerobics. Took off a little bit of the extra weight, but it really wasn't until after my residency that I really started. I started exercising regularly and competing. It probably wasn't until I was 30 years old that I did my first triathlon. And that was an awesome experience. So it was really in my 30s that I was more of the avid athlete. In my 20s, I more exercised to stay fit.
Did you go out and do dancing and things like that along the way in your 20s to do, as a fun thing, and which translated as some cardio?
Um, I don't know that I did dancing as fitness. I mean, I did like the Tai Bo classes because those were pretty big in the late 90s. And I did some aerobics. I mean, that kept me fit.
Yeah, there you go. So Dr. Heather Shenkman's website is Dr. Heather Shenkman, SHENKMAN.com, and I'll have that below in the comments. And so, as a resource, what are you providing right now on your website, and where do you want to take it in the future?
Well, my website, I talked a little bit about the basics of heart disease, but a little bit about kind of what I do as a cardiologist. And I'm actually offering programs regularly in my office to help people to kind of educate themselves about heart disease. Last week, I had a program featuring my friend Lori Manby, who on a plant-based diet lost 80 pounds of Weight Watchers and really, reclaimed her health. And she gave some really good insight into kind of the mind of, what makes one decide to finally lose weight, how to successfully lose weight, how to keep it off. I'm going to be doing a program later this month on hypertension or high blood pressure because I think that's something people care about. I think more than half of this country has high blood pressure, and people want to know if there are alternatives to medications. Are there things that I can do so that I can maybe not need to take as much medication? Are there alternatives that also treat hypertension that might work with medications? So I'm going to give a talk about that, and I think people can get a lot out of it. If you're concerned that you're going to develop high blood pressure, if you already have high blood pressure.
Wonderful. Are you do you have a spot on your website where people can sign up to be on your email list and your webinar list, where they can type in their email?
Well, I don't quite have an email list at this point, but every month I'm posting under, I call it Heart U or Heart University. I have posted the activity and the lecture of the month, and anybody who wants to attend, just sign on up. It's free to the public.
Got it. I'm gonna take a look at that. And so yeah, if you do need someone to share what they've learned, here's one thing that I've mentioned to you before: the aging athlete. And I think you could call what I've uncovered a syndrome, because what I found is that these high performance physical people, the dancers, the ex-military, the high school, college, pro athletes, landscapers, they go through this transition of being a young physical person. Then they, at some age, whether it's age 6, 8, 15, 20, whatever it is, they switch gears from more recreational and a little bit of competition to this high performance. And then they do that for a number of years. And like a general contractor climbing ladders all the way until they're 65, that's pretty darn heavy duty, lifting, drilling, climbing, digging, all that type of stuff. And they're called industrial athletes, according to some people who work work in that category with their health. And then the aftermath. What do you do with the rest of your life if you leave the NFL at age 25, or if you leave Soviet gymnastics in the 1970s? You were 16 or 17 and it was time to retire. What do you do with the rest of your life? And unfortunately, my research is showing that these people are not trained in what to do afterwards, and they may not even be wired for wellness. So they're so wired for performance that they tend to suffer afterwards from sedentary behavior, and then even poor diet, because the poor diet drowning your problems, your stress, your anxiety, and what have you. It's hard to come down after you are a high performance physical person, whether you're at the elite competition level or you're just a military person leaving the military. It's hard to come down from that rigorous structure and drill sergeants and coaches. So if you'd ever care to share an hour conversation online about that for some of your people, who some of them may be these high performance people, I'd love to bring what I've learned to those folks and share that.
Great.
Any parting words? Oh, here we got to show our running sneakers, so I'm going to show my my Vibrams, and these are just ordered about 3 weeks ago, and now I'm using them with much happiness. And tell us about what you're using these days, Dr. Heather.
These are my Brooks Adrenalines. And these are fantastic because I have nice, long, size 12 feet, and I have flat arches. So these give me just enough arch support to be able to run comfortably.
Oh, yeah.
And choice for years.
Wonderful. Yeah. You mentioned, the structure of the foot. So I don't have the flat arches, but I mentioned this to you before. I had plantar fasciitis, and it's still, the remnants of it are in there. So I'm rolling on this front to back is what a certified massage person who handles triathletes taught me, because I was getting no results just doing my normal rolling on this. And she said, front to back, that's the secret, and try that. And I did. And then she said, also the stretches like you were beginning a sprint race. That heavy stretch on the Achilles and the calf, and the foot being down, and your body being down like you're about to be in a sprint race. So those two things, plus all of my calf rises and my anti-inflammatory diet and protocol, that's really helped a bundle. And so at age 55, I feel like I've got a way to maintain that. So any history with you and foot issues?
Oh, absolutely. I've probably struggled with plantar fasciitis for the past 1 year. It was bad enough in the fall that I actually had injections from a podiatrist. I ended up getting totally 3-foot injections, and it's better to the point at which I can run a couple of days a week, but it still flares up. So every so often, I'm still sleeping in a splint so that my foot is flexed as such. And I'm rolling, and I'm every so often icing. I'm trying to stay away from non-steroidal anti-inflammatories because those just really aren't good for us, not good for the heart in the long run. But I've kept it pretty well at bay.
Wonderful. So drheathershenkman.com is her website. I'm Sifu Slim at sifuslim.com. And I've got a YouTube channel, as you know, and there are many videos up there that are there as resources to the viewing public on the internet. And we hope you've enjoyed this conversation. And we welcome your feedback below the video. And if you have any questions, and we have a chance to touch base or allow the public to share what they think about your questions, please add your questions. If we were to do another talk, maybe a few months from now or 6 months from now, is there another topic that you're interested in sharing with the viewing public, Dr. Heather?
Oh my goodness, there's all sorts of things I'd love to talk about. I mean, certainly the aging athlete is certainly something you're passionate about. We could talk a little bit about that. We could talk a little bit about preventing and treating heart disease with lifestyle, diet, and exercise. Yeah, I'd love to come back and talk to you more.
So we've got an open invitation to each other and to the viewing public to find out what we're going to talk about in the future. So I think this is wonderful. I really welcomed the chance to share the Aloha spirit when you're here on the island. I heard you talk and was very moved, and so I hope to continue with learning from you and sharing what I've learned in the future, Dr. Heather. So all the best from the land of Aloha.
Thank you, Sifu. Thank you for having me.
Bye-bye.
Goodbye.